Hello, everyone, and welcome to a webinar organized by Newristics. The focus of this webinar is how to win at non-personal promotion. Specifically, we're going to share some ideas and some strategies with you on what you could be doing almost immediately, given the situation that every pharmaceutical company is in because of the COVID-19 related lockdown. Everyone is dependent on non-personal promotion as the primary channel for physician promotions and messaging. And as a result of that, every brand team is trying to make the most out of their NPP efforts. This webinar is dedicated to discussing ideas that can be highly actionable in how you can use tools that are available to you right now to maximize the effectiveness and efficiency of your non-personal promotion efforts quickly, because right now it's not very clear how long the lockdowns will last. So it's imperative for us together to start making NPP much more effective. So we'll jump right in. Let me just quickly introduce myself. I am Gaurav Kapoor. I'm the president of Newristics. I like to think of myself as a message optimization enthusiast. I have a crazy idea to try to optimize the world's messaging. As an organization, Newristics is on its way to slowly, but on the right path to becoming a source for messaging optimization work for many companies around the world, mostly focused on healthcare and specifically with pharmaceutical companies, using a combination of behavioral science and artificial intelligence to create a set of tools that marketers and market researchers can use to optimize their messaging before they go to market, when they're in the market, after they've been in the market for a while, throughout the whole cycle. So as we discussed earlier, the goal of this webinar is to share ideas on how you can use science, technology, and algorithms to make non-personal promotion for HCPs more effective. So NPP is efficient already, and you can do a lot of it cost efficiently because the lead times are shorter, the cost of deployment and execution is much lower. But the problem is it's not as nearly as effective as personal promotion. And there's a ceiling to how much you can do before the customer just starts becoming intrusive. So the limited exposure you do have available, if you can make it much more effective, it can be a very powerful marketing lever for you. Maybe not as much as personal promotion ever will be, but certainly can be a lot more effective. So today, some combination of science, technology, and algorithms, which are not the same things, but they're quite interlinked together, are available for you to make your non-personal promotion efforts more effective. And that's the goal of today's webinar. So let's see how we can do that. We talked about 6 strategies that you can think about. Let's just walk through each one first and see how science, technology, and algorithms, where they fit in. And then we'll dive into a little bit deeper into at least the first 3 strategies here in this webinar, and then we'll pick up the rest in a subsequent event. So the first thing that can make NPP efforts more effective is to segment your customers and then start customizing your messaging to segments. Now, this is something that on the surface, this is not a new idea, obviously. Every marketer knows that. But in reality is where a lot of people struggle to segment their physician target list in a way that segment-based messaging is actionable. So if the target list is segmented into based on deciles or based on institutional affiliations or any other, call them practicographics, all of those variables can be very helpful for targeting and call planning purposes, but rarely are they used or can even be used for segment-based messaging, which is what NPP can benefit from. So today we'll focus more on how can you segment customers using heuristics. Decision heuristic science, or also commonly known as behavioral science, is a science that tells us that customers make decisions using heuristics. And if you can segment different groups of customers based on how they use heuristics to make decisions differently, you can now make your segmentation a lot more actionable in terms of messaging differently to different segments, which brings us to the next step, which is customize your messaging to different segments using heuristics. So this is an idea we'll talk more about. Segment the customers using heuristics, create messaging using those same heuristics, and then execute in the market. Now, the next step, NPP benefits exponentially from experimentation, which is something in personal promotion is not easily executable. You can't, with hundreds or thousands of reps, you can't easily experiment. The experiments are hard to set up in the field. It's hard enough to get the reps to focus on your top 3 core messages and deliver them consistently. Experimentation, it can completely throw a monkey wrench into call delivery. But in digital channels and in non-personal promotion channels, experimentation is not only easy to do, it's almost an imperative. If you want your NPP to be more effective, you must experiment. And you must set up the experimentation in a way that can, in a sense, turbocharge your learning and your training of your algorithms, if you will, that can help improve the delivery of non-personal promotion. There's many aspects. It can improve the messaging. It can improve the timing of messaging, the sequence, the cadence. There's so many things that can be optimized in non-personal promotion. But all of the learning has to come from experimentation. And once again, if you use heuristics to set up the experiments, you now take the learning from the experiments to a new dimension. We'll talk more about why that is, and how you can set up your experimentation using heuristics. Once you've done enough experiments and have now started to train, if you're using machine learning or AI, to start optimizing elements of your non-personal promotion, now you can think about automating many of these tasks. And there are many technological platforms that have been developed that can allow you to automate the delivery, the data collection, the analytics, the ROI measurement, etc. And you might already be using some of it, even though you may not be messaging to segments differently. You may not be experimenting at the level that you possibly can. You may not be yet training your algorithms. You can still use automation technology to automate the whole process. But if you're able to do some of the steps 1 through 4, then your automation technology suddenly starts becoming so much more productive for you. And this is something that we will touch less on in this webinar, possibly more in a follow-up webinar on this topic. So let's start with segmentation. Segmenting customers for NPP in a way that segment-based messaging becomes a reality. So research we have conducted with pharmaceutical brand teams, We estimate that most brands have a HCP segmentation in place. Most of the time, it's a behavioral data driven segmentation. But many people have further overlaid market research based segmentation on top. So it becomes more like a hybrid segmentation, but they have something in place. But less than 10 or 20% max of brands are successfully utilizing their HCP segmentation to activate the segments they want to or they have created or identified with customized messaging. And we could spend time about talking about why that is. Like why, if you have the segmentation, if you believe it's a good segmentation, you know who the segments are, why isn't there a message map that lays out clearly what the segmentation is for each, what the messaging is for each segment, and why it's not easy to execute on those segments? We want to focus on a solution um, um, that can possibly make you think about how you can improve or close the gap that you have right now, how you can convert your segmentation into segment-based messaging. And the solution, if we were to use literally one word, is heuristics. Use heuristics to activate segment-based messaging. How? First of all, segment customers based on their decision heuristics. Now, you may say, I already have a segmentation. I don't want to resegment. I don't want to create a whole new segmentation. Not a problem. Even your existing segmentation can be enhanced or appended with decision heuristic science. And you can attach heuristics to your existing segments. We'll show you exactly how to do that. Now that you have heuristics identified for even your existing segments, you can almost put all the other information about those segments that you may be sitting on, put it aside. You don't need it anymore. This is a very new and possibly counterintuitive idea that you may not have thought of before. And initially, when you first think about it, may not even sit right with you because it's something that, like how can you not, why wouldn't you want to utilize the information that you have on your segments? And we'll make a case to you about why you actually, it's not that you can't utilize, you don't want to let that information create noise in that you don't need it. Once you have the heuristics for each segment, all you need to create messaging for that segment is the heuristics. And we'll shorten the path for you to at least that that basically customizes your messaging to the way each segment is making decisions in your category using heuristics. Your messaging will start talking to those heuristics and the appropriate heuristics for each segment. So let's take a look at how that happens. We talked about how you may already be sitting on a behavioral segmentation. Behavioral segmentation is based on what physicians are doing. In most cases, it's what they're prescribing. It could be at the class level, it could be at the brand level, it could be generic versus branded, et cetera, et cetera. But it's all about what they are prescribing or what they're doing. Decision heuristics is all about why people behave in the way they do. So behavioral segmentation is how they're behaving or what they're doing. Decision heuristics is the explanation for why possibly they're doing what they're doing. The behavioral segmentation doesn't tell a marketer or the lead copywriter at the agency or the brand team in total what to say to each segment, unless it's a behavioral segmentation based on some very limited variables like generic versus branded. You at least have some idea on, okay, what do you can deliver value messaging to the customers who tend to write more generic products. But in most cases, it's not as simple as that. So if there are high volume writers at the class level versus low volume writers, if you don't know why they're high or low, what do you say to them to convert their behavior or change their behavior? So you need that intelligence, that why, and then decision heuristic science can actually bring that why to you. You're sitting on the what right now. If you can attach heuristics to your segments, it brings you the why, at least very strong hypotheses for why, explanations, and then you can use those heuristics to develop messaging. So let's take a look at how this could practically be done. And we're trying to make this as tangible in a short webinar for you as possible. You want to identify a short list of dominant heuristics for each physician on the target list. And then once you've done that, physicians will automatically cluster based on what heuristics they are driving their decision making. And you can do this with the secondary data that you already are sitting on. You start with the target list. Whatever data you used to create the list in the first place, that data may already be enough. In some cases, you might have to add some additional data. It all depends on what was used in the first place, but you're still with data. You're not actually going out to conduct market research, which is important because right now you don't really have time to do that. And neither is it a good time to conduct that kind of market research, given the fact that physicians' offices are closed, et cetera, et cetera. So you attach some additional physician, maybe patient level data, so that you can see how over time physicians treat patients, what their treatment algorithm looks like, etc. Now, apply, we'll call them business rules for now. Apply business rules to this data. Each rule corresponds to a decision heuristic. It's a proxy, or it can detect the signal for whether a heuristic applies to a physician or not. And if the physician shows high propensity for a given heuristic based on the rule that you're using, then you can assign that heuristic to that physician. Now, would this process be perfect? Of course not. But segmentation is never perfect, and if that's a requirement, then you'll never be able to execute anything. But um, it can be accurate enough that you can see very significant improvement in your segment-based messaging capabilities. Once you have, using these business rules, you can start assigning heuristics to each physician on the target list. All you're really looking to do is figure out what are the top maybe 3, 5 heuristics for each physician. And once you have that, messaging to that physician will become clear very quickly. Let's take a look at how that works. First, let's take an actual example of how you could use the data and a business rule to come up with whether a heuristic applies to a physician or not. So out of hundreds of decision heuristics that have been discovered in behavior science and have been proven to influence some aspect of human decision making, one of them is called rule of consistency. Let's introduce that heuristic first. This heuristic, by the way, the word heuristic means shortcut. A decision heuristic is a mental shortcut that you use to make decisions in life. Sometimes the decision you need to make might kind of send you towards using this here's mental shortcut to make that decision rule of consistency. What is it? Humans feel the need to maintain a consistent image of themselves and will even repeat bad decisions to maintain an image that they have already established. It's a it's a image projection problem that we get stuck with both in our own mind as well as in the eyes of the people around us. We feel like we need to, this is who I am, this is how I do things, this is how people know me or understand me. And now I need to kind of sort of protect or defend my image, even though I probably shouldn't be. It's probably no longer reflects, it no longer reflects who I am in the first place. It's probably not even a good image to maintain. There could be many, many reasons why you shouldn't be doing it, but you can irrationally keep doing it sometimes for years, decades even, um, only because you kind of don't see the irrationality in what you keep doing. So let's say we want to see if there are some physicians who are really driven heavily more than usual by this rule of consistency, right? And we can now, what kind of data can we use to see how different physicians are being driven by this heuristic or not, differently or not? We could possibly look at, for each physician, we could look at how they treat patients from the beginning, like first line therapy, second line, third line, and what percentage of patients in their practice are they treating very similarly with the same treatment algorithm over and over again. And if you can decide where the cutoff can be, it could be 70%, it could be 50%, 80%, whatever. That depends on the disease state, it depends on your thresholds. You can set a number, you can play with it, you can even change it. But you can say that if a physician is treating X% or more patients in their practice um, with in the same kind of consistent way or with the same similar consistent treatment algorithm, then we will tag that physician as a physician who's heavily driven by rule of consistency heuristic. Now, again, is this perfect? No, but it's definitely driven by data and science. You may even have multiple rules, business rules, that are tagging a physician into this rule of consistency heuristic. This is only one example. Maybe there are other data points that can also be used. So you can be double sure, triple sure. You're triangulating with different data points to basically see if a physician is more than average driven by this heuristic. So this is an example, tangible example of how you would do this. Now, there are many heuristics, and heuristics do change by disease state. So if you have a list of heuristics that physicians use in your disease state to make decisions, this becomes easier. Now you simply have to start with that list and think about what data and what business rules you want to apply. If you don't have that, it's also something that can be identified relatively quickly. There are tools or there are resources available for you to identify the quote unquote list of top 10, 20 dominant heuristics for any disease state. So using this technique, you can start identifying for each physician on your target list, you can start identifying what are the top 3, 4, 5 most important heuristics that drive this physician's decision making. Now let's take a look at how that information very directly, very linearly, shortest path or path of least resistance, it drives segment-based messaging, or even it could even be if you have the ability in NPP to do one-to-one messaging customization, you can even go there because you have the heuristics at the physician level. Let's see how it drives messaging. So mostly I covered this already. You would have for each physician on your target list, you would now have tagged them with, let's just say, top 3 heuristics. You know what each heuristic is, and you have used your propensity kind of scoring model. Now, physicians who have similar heuristics in their top 3 can be clustered into one segment, or conversely, if you had a segmentation already and you want to stay put with that, you can figure out across all the physicians in that segment what are the most important heuristics. Either way, if you, depending on how you want to approach it, both of them are viable options for you. You can nevertheless get to either you can have the top 3 or 5 heuristics for each segment, or you can go down to the physician level and then back up into a segment if you need to. So now let's take a look at how messages can be customized to segments. And each segment has a few heuristics that are really much more applicable to them. So you would want to use these heuristics to create customized versions of the message of your messaging. So let's take a live example. Here's a message: product X plus product Y significantly prolonged progression-free survival versus product X in the clinical trial. We have 4 segments. You can think of this message as a universal segment agnostic or cross-segment message, whatever language you want to use. For segment 1, let's just say complication bias is one of the kind of top 3 heuristics. One way you start customizing is this exact same message could be delivered to all the physicians in this segment if you wanted it to talk more directly to one of their heuristics, complication bias. Now you may write this message differently. It's the same information, right? But how you say it is very different, and now it feeds complication bias. And the changes are not dramatic. Like there's only like subtle language that needs to be inserted in the message that makes the message more relevant to this segment based on the fact that they already make decisions using complication bias. Similarly, segment 2, maybe they are driven by a heuristic called ambiguity aversion. They don't like unknowns. The devil they know is better than the devil they don't. Once again, you could play with language if you want to fight ambiguity aversion. To communicate certainty, you can now play with language, and this is an example how you may customize the exact same message that's here and present it differently in NPP to physicians in this segment. Segment 3, let's just say customization bias is an important heuristic for them. Now suddenly, this message, again, sometimes in all the cases so far, there's literally 2 words that are being curated or just very carefully structured to either feed or fight the appropriate heuristic for that segment. And lastly, segment 4, if they were driven by rule of consistency, which by the way was a heuristic we just went through. Now in this case, more than 2 words are being used, but the message customized version of for segment 4 is not much longer than the original. It's not like we've added significantly more language or copy to the message. This is still very much manageable in NPP channels. So this is an example of how you had segments, you attached heuristics to segments, you take your pre customized or pre segmentation message, now you customize it to each segment. Now, if this is too much complexity, even for NPP, based on what you're set up to execute in the market, then don't create like four different versions, only focus on one segment or two. There are many ways you can still draw the boundary on how much complexity you want to add to your NPP efforts or not. This is just showing if you wanted to go all the way, you absolutely can. Now, if you actually kind of continue down this path, you can pretty much end up with call it a message map that can take your pre-segmentation messaging and now create segment-based message map that you can now execute in your NPP channels. So let's take an example of that. Let's say for each segment, you have a few heuristics. We'll call it 4 heuristics in this case. This is a diabetes example that we're going to walk you through. So segment 1, let's say their top heuristics are illusion of control, information bias, overconfidence effect, compromaxing. You kind of start getting a picture of this segment. They think they can do it all. They want it all. They think they can do it all. They want everything in the product that they use. They want all the information, et cetera, et cetera. Segment 2, very different segment. Diffusion of responsibility, empathy gap, actor-observer bias, anchoring effect, especially these 3 heuristics here. They can't feel the suffering of the patient. They blame the patient for their own A1C, lack of A1C control. They think the patient is dragging their feet. The patient doesn't pull their weight. They're the ones to blame, etc. So we won't possibly go through every single one, but you get the idea for how you can start seeing like different segments may have different heuristics attached to them. Now, for segment 1, overconfidence effect is a heuristic that drives their decision making. Let's feed it. Let's deliver a message to them that encourages them to think that way and make decisions and think of our brand in that context. Product X provides the power for you to treat your patient with confidence, with reliable and safe A1C reduction. Feeding overconfidence effect. Information bias. Studies estimate that high glucagon levels are responsible for as much as 50% of the increase in blood glucose after a meal in type 2 diabetes. This is an unbranded disease state education message that is feeding information bias. Compromaxing. Don't just settle for A1C drops. Product X gives you additional benefits like weight loss and BP reduction without an increased risk of hypoglycemia. They want it all in the product that they want to use. Lastly, let's look at another one, illusion of control. Make a difference in your diabetes patients' lives by helping them reach A1C goals with Product X. So you can see in each message, by this time you can probably recognize language that is feeding or fighting each heuristic that drives this segment's decisions. This can be done for every heuristic, for every segment. This is essentially a message map. Once you have this laid out, you can very scientifically start structuring message delivery in all your NPP channels using this map. If you want to run some campaigns where you are kind of delivering cross segment messaging, you wouldn't be customizing very much. You could be running other campaigns where you are totally customizing. There's no cross segment messaging. This creates many, many opportunities for you to experiment and try to start learning about which segments are responding to which messages more based on which heuristics and based on what kind of language. And the learning can help you either double down on what already works and see if doubling down adds even more effectiveness, or perhaps diminishing returns kick in. All of these become possibilities from a quote unquote optimization standpoint. So the message map that we kind of walked through, you can have cross segment inventory of messages that some campaigns, or maybe every campaign, has to contain some messages that are kind of more universal in nature, and every segment will get those messages without customization. And then the remaining messaging in the campaign can be segment customized. And for each segment, you have a specific inventory of messages that you'll be drawing from. This allows you to now set up more structured optimization and of the delivery of NPP messaging at the segment level. So now that you have done all that, which is a lot of like foundational work that can really pay off and pay off quickly, what you can now, you're actually well positioned for the type and the amount or extent of experimentation you should be doing in NPP. Two things to keep in mind for the experimentation. You want to, you're using heuristic science to conduct content experiments, language, or what you're saying. You're using heuristic science to conduct those experiments. Why? Because once you get results and you see certain physicians are responding to certain messages, the message is written to a heuristic. If they respond well to that message, it by default means they're responding well to that heuristic. This is something we have extensively studied and proven that almost all the time, the most important driver of a message appeal is the language that talks to a heuristic or the heuristic in that message. Not that other things are not important, clinical data, etc. Those are important, but the language that talks to, and it's not just language, even data can be structured using heuristics. But wherever the heuristics appear in a message, that's what's driving the appeal. So this is a very powerful tool because all you need from the customer is behavioral response, that they open this email, more people open this email. If that email was written to rule of consistency heuristic, you can safely conclude that that is a heuristic that is giving you greater effectiveness for your messaging. You should try more messages or different messages written to that heuristic. So it gives you the why automatically without you having to conduct research or do some other work to figure out what the why people are responding to that message. Now, outside of the content, there's a whole bunch of executional variables that are also important to optimize in NPP delivery. And you can and you should be experimenting on all of them as well. And it could be for many, all the different channels. It's executional experiments are also very important. The timing of what day the email should go out, what time of the day, um, the length of the email, the length of the subject line, the frequency, the sequence, and the cadence. These are all things that are can be studied through experiments and should be studied. And this is where technology and algorithms are playing a big role in allowing you to create a lot of options, automatically try different things. The technology so far to create content, especially the kind of highly complex content that pharmaceutical brands have to put in front of HCPs, that technology is not nearly as good yet, or the algorithms that they can't generate content for you. It's one thing to generate content for a product page for Amazon versus to generate messaging for a rheumatologist in RA or PSA. Right now, right now, machine learning or AI type of platforms would not be very effective in doing that. It's too complex of a task, even if you have lots of data to train. So again, experiment the content with heuristics. Here's an example. Email is obviously an important NPP channel. You could have, the email, you have subject lines. You could have many subject lines written, each subject line written to a heuristic. It could be different heuristics for each segment. Have you tried this proven add-on therapy for your patients with MDD, major depressive disorder, or depression? Information bias segment, you could just say, learn more about treating MDD. Empathy gap segment, you could say, your patients with major depression disorder need your help, and so on and so forth. So you can kind of see how, and if you have even the top 3 heuristics for each segment, and you know how to use heuristics and embed them in language, you can create hundreds of subject lines very quickly. For each segment, there could be many, 10 of them, whatever. You can create many, many options that you can now take into testing. Here's an example of this is a medical device, but very close. Here's an ad, like a search ad, so if you were searching, and this could be like one of the paid ads that could come up with a little copy headline at the top, and then it's got like links to certain sections of your website. Intraoperative hypotension. A minute can mean a life. Visit Edwards Life Sciences. Segment 1, if they are driven by illusion of control heuristic. Segment 2, if they are driven by ambiguity aversion heuristic, let's say. Now, you could change the headline and the subhead to feed illusion of control. You could change to feed ambiguity aversion. Intraoperative hypotension, making life and death decisions. Edwards can help. Clinicians, post-operative complications can undermine the success of your procedure. It's all about their illusion of control. Making life and death decisions, undermine the success of your procedure. The language is basically talking to their illusion of control. Here, the language is talking to their aversion to unknowns and ambiguities. Not sure about intraoperative hypertension. So much can be unknown about postoperative complications. So you get the point, right? How you can almost manipulate language to talk to certain heuristic. And again, you can create many alternative versions of now, in this case, a display ad or a search return ad. Again, you could possibly create tens or even hundreds of them if you wanted to, really turbocharge your experimentation in NPP in on for display ads. So hopefully this helped you kind of connect the dots between. Let's go back to where we started. The idea that we're presenting is segment your customers. If they're already segmented using behavioral data, use that data to attach heuristics to each segment. Once you have the heuristics for each segment, put the data aside for messaging purposes. The data is not useless, but for messaging purposes, put all the data aside so it doesn't create any noise. Focus only on the heuristics. Use heuristics for each segment to create a message map for segment-based messaging. Create a lot of choices. For each segment, you can also have cross-segment messaging as well. You can create many choices for that too. Use heuristics to create the choices. Make it a scientific process, less driven by creative copywriting, more driven by science. Now, experiment like crazy. Some or many of your experiments might fail or might show no improvement, but every experiment is going to give you some learning, good or bad. It's learning that you can utilize to get better next time. So experimentation is a must. This is something that retailers or e-commerce or technology companies literally run their entire business or experimentation every single day in their business models. A whole bunch of experiments are being done automatically. This is not something that's part of the culture within pharmaceutical, and legal doesn't make it easy for us to do that either. But it is something that NPP thrives on and almost is needed for NPP if you want to get better at it. So we brought up kind of this webinar. We focus on these first three steps here to how to segment in a more actionable way, how to use that heuristics-based segmentation to create messaging for each segment, how to create a message map that creates a lot of different messages for different heuristics, and how to then start experimenting. We also talked about experimenting for content, experimenting for executional, a whole bunch of other executional variables. In a subsequent webinar, we'll talk more about what kinds of tools and technologies and platforms are available, specific companies that have created some really interesting offerings that you should, if you haven't heard about them or you haven't tried them, you should definitely look at them, that can allow you to, if you have this done, they can't help you with this part, 1 to 3. But if you have that done, they can definitely, you can now definitely use their platform to start training algorithms to start predicting or perhaps even generating messaging for the future. Certainly, if you don't want to go that far, to certainly start predicting before you even do the experiment what the results might be and start improving things. All the way to now automating the process of running these campaigns in a like almost like a hyper efficient process. So for this webinar, we'll pause here. Thank you for joining. Hopefully you picked up some really actionable and tangible intelligence that you can apply and maybe even discuss in your next brand planning call, where you're trying to discuss what to do next in your non-personal promotions. Thank you again for joining.